Hi, everyone. Thanks so much for joining us for our June webinar. We're very excited to have you here tonight with Dr. Jennifer Bricks from the Natural Factors team, who's going to talk to us about some hormone health. So just a couple of housekeeping items before we do get started. Yes, the session will be recorded and it will be sent out to everyone who registered. We also have some information that will come along with that from Dr. Jennifer. If you do have any questions or comments, please put them in either the Q&A section or the comments section, and we'll get to the questions at the end of the presentation. And most of all, have fun, enjoy. And without further ado, I will turn it over to Dr. Jennifer Bricks.
Thank you, Michelle, and thank you everyone for joining me tonight. As Michelle mentioned, I'm Dr. Jen. I'm a naturopathic physician and I practice in Victoria, BC. And I've been practicing for 12, 13 years now. So it's creeping up to quite some time. And so I really enjoy educating, especially about hormones and digestion. So this is great. This is a really good opportunity for me to share both some knowledge that about supplements, but also some clinical pearls. I always like to kind of throw things in there if I've seen examples of patients that have had some problems. And so I'm hoping, again, if you guys have any questions at all, please feel free to put those into the Q&A box or the chat box, and we'll go through that towards the end. But I guess without further ado, we'll just get into it and start learning about the Oat Axis. So the agenda for tonight is first just talk about the importance of hormones for health. Again, I'm sure all of you are here because you are experiencing or have experienced hormone maybe imbalances or changes or something like that. And so we'll talk about why hormones, first of all, are important. And then we will talk about the consequences of hormonal imbalance and what that may look like. We're focused here on women's health mostly tonight. The Oat Axis consists of the ovaries, the adrenal glands, and the thyroid. So we're going to go through each of those and how imbalances in that axis can impact your health, and then what you can do. So what nutrients, what herbs, and also lifestyle changes that you can do to support the entire axis so that you can achieve hormone balance and reduce those symptoms that you may be suffering from. All right, so to start off, first of all, what are hormones? Well, they are powerful chemical messengers. They are produced by the glands in our body called endocrine glands, and there are many different endocrine glands. You can see in the image there over on the right. So in both male and females, we have pituitary and hypothalamus in our brain, as well as going down into the thyroid. We have our adrenals. We have the pancreas, right, secreting things like insulin. The gonads, so the testes and the ovaries, and of course the uterus as well. And so once these hormones are released from these glands into the bloodstream, they will travel to different parts of your body and then exert their effect. And they help us do so many things in our system. So they help manage stress, cortisol, balance blood sugar, metabolism, manage libido, balance the reproductive system, support growth and sleep like melatonin, and of course, so much more. So we traditionally have thought of different axes in our body, and maybe you have heard of something called the Hpa axis. This is a commonly discussed axis. So the axes are essentially connections between different parts or different endocrine glands that are very much interconnected, and one will affect the other. We typically have started out with discussing the hypothalamus in the brain to the pituitary, which is also in the brain, and then down into the different components. So we have the HPT axis, which is the hypothalamus pituitary thyroid, the HPA, the hypothalamus pituitary adrenal axis, and then the hypothalamus pituitary gonadal, or the HPG, which is the hypothalamus pituitary ovaries or testes. And these axes have been widely studied. We've discussed this for decades on how to manage each of these axes individually, but there has now been considered to be a fourth axis, essentially, which is between sort of the last final offshoot of those other axes, which is the Ovarian-Adrenal-Thyroid axis. We call it the Oat Axis for short. Now, this was essentially, for, I would say, decades or even longer, we've known that imbalances in, say, the ovaries can affect the adrenals and vice versa, as well as the thyroid. It was also kind of common knowledge, but not really scientifically proven or studied. And it was actually Dr. Michael Lamb, who's a medical doctor, that, if I may quote him, said that if the adrenal glands are weak, there is often concurrent thyroid malfunction and menstrual cycle irregularity. Similarly, in an underactive thyroid will often make adrenal fatigue worse off. And lastly, those who suffer from ovarian hormone imbalances like estrogen dominance often have pre-existing subclinical hypothyroidism exacerbated. And he actually studied this, and he noted that indeed those symptoms, we see those symptom connections, and now we can see that actually, yes, there are physiological biochemical connections that really create this axis. And because we now know that, there are many ways we can actually support that entire axis. So conditions commonly faced by women, which is influenced by the Oat axis, and you may or may not check off multiple of these, but the first is stress. And again, most of us have probably experienced stress, whether it's acute or chronic. Extremely low energy, issues with coping or feeling overwhelmed, sleep difficulties, headaches and migraines, mood changes like anxiety and depression, estrogen dominance, which we will go into a little bit more deeply today, hypothyroid or hyperthyroidism, infertility, PMS, weight management or weight issues, perimenopause and menopause, heart disease, and autoimmune conditions. So to help prevent symptoms related to the Oat axis, we want to essentially support each of the individual glands, or at least be able to identify perhaps the weaker ones in your system so that you don't cause further exacerbations in the other glands of the Oat axis. So we'll start off with how to support the first one, which is supporting the ovaries. So here's a lovely photo of or image of the uterus with the 2 ovaries on either side. So females generally have 2 ovaries. They're about the size of a large grape, and they produce reproductive hormones, including estrogen and progesterone. They protect the eggs or the oocytes, and they release eggs for fertilization. Now, there are 3 naturally occurring estrogens. Estradiol is the main one that is primarily made in the ovaries, but there's also estrone and estriol. These are made in the liver from estradiol, and we're going to kind of discuss how to promote that healthy metabolism. Fat cells and adrenal glands produce small amounts of estrogen as well. So we see that women that have larger fat cells or who are overweight or obese can produce more estrogen and create estrogen dominance. And estrogens will influence the health of our reproductive system. So also incorporating the benefits to bone, brain, mood, heart, and breast health. Now in men, estrogen is also important and can affect libido and energy as well. But of course it is more a female hormone. So estrogen is very important to female health. However, estrogen has actually been considered and was, I can't remember the year, but it was actually put into the category of a carcinogen if in poorly regulated or elevated levels. Estrogen can actually encourage certain cancers in the body. And we know that we live in a sea of estrogens because estrogen looks a lot like some of the chemicals out there in our environment. Things that affect estrogen include poor diet, obesity, high insulin levels, medications like hormone replacement therapy and oral contraceptives or birth control, and that overexposure to harmful chemicals. This can really influence estrogen production, metabolism, and create an imbalance in our estrogen. Some of the estrogen-like or estrogen disruptors, like endocrine disruptors, include BPA, which is found in or has been traditionally found in lots of different plastic containers, as well as the insides of many canned goods. Heavy metals, specifically lead and mercury, PCBs, and phthalates, which exist in a lot of our cosmetic or body care products. Now, these are called xenoestrogens because they are foreign forms of estrogen. They look similar to estrogen in our body, and therefore they can actually react to the receptor or bind to the receptor in our body and essentially create estrogen dominant-like symptoms. There was also a really interesting study done in I think the early 2000s, in which they were biologists were noting certain populations of alligators in Florida, population having some severe issues. This was in Lake Apopka. If you have heard of it, then you know the story. And it's actually, I got a photo of it there in the bottom right. And it traditionally, you know, in the early 80s and 90s, you could go out on a boat at night with your flashlight and count hundreds and hundreds of alligators, which is a little bit creepy, but essentially very, very healthy population in this lake. And unfortunately, this lake was downstream from a factory which had quite a bit of byproducts that were xenoestrogenic. And within about 4 or 5 years, the population from hundreds and hundreds that could be noted on any given night went down to, you know, a few dozen. And what they determined was that the xenoestrogens were actually creating infertility in these animals. The males had much smaller gonads, and actually some of them were almost converted to female in terms of their hormones, and they were no longer able to reproduce very well. They also unfortunately found that downstream from this lake, panthers or pumas were also noting very strict issues with their fertility. And that again was all because of the excess estrogen that was being consumed and that they were exposed to in their environment. And we are exposed to similar amounts of toxins in our environment, whether it's externally or actually in our home. So when you are looking at your burden of estrogens, do consider looking at the toxins that exist in your home, whether it's things that you drink out of or cook out of, whether there's plastic or styrofoam, household cleaners and dryer sheets, different shampoos, lotions, and perfumes, deodorants, and air fresheners, and in cosmetics, including nail polish, as well as medications. So a lot of these things, as I mentioned, contain things like phthalates and other endocrine disruptors. So if that's the case, and you suffer from symptoms of estrogen dominance, or whether you do or do not, it is a good idea to start detoxifying your home and purchasing things that are more clean for yourself and the environment. BPA is one to always avoid if you can. And if you have plastic goods, or if you look at bottles on the underside, you will see recycling codes. So the ones to really avoid would be codes 3, 7, or if you see the letters PC or PVC. And again, those are going to be all high in endocrine disruptors. You also want to be aware of the toxins in your food. So every year, the Environmental Working Group, or EWG, comes out with a dirty dozen and a clean 15. So this is the updated list, comes out around, I think, April or so, kind of around Earth Day. And it's based on the amounts of spraying or pesticide residues that are found in the most common foods that we consume in North America. So this year, the dirty dozen includes strawberries, which is almost always top of the list, spinach, kale, nectarines, apples, et cetera, so you can see there. So generally you want to avoid purchasing the dirty dozen unless you know that it is a clean source, if you know the farmer that you're getting it from, or if it is organic, then that's when you want to eat those types of foods. Or otherwise, the clean 15, you don't really have to worry so much because they are either not sprayed at all. They have a very, very clean profile. So avocados always tend to be on the list as well. So don't go and spend the extra dollars on an organic avocado. You can just get the plain ones. And same with, again, sweet corn, pineapple, onions, and the list goes on there. So update yourself every year, avoid the dirty dozen, and don't worry about buying the clean 15 organic if you don't want to. There's also a mean 15 out there. Adria Vassal is a Canadian author, and she's written several books. And if you just Google that, Google her name and the mean 15, it includes sort of the top 15, again, things you'll find in your household that you want to avoid. All right, so are toxins in your home and your food really a cause for concern? And the answer is yes, because these xenoestrogens are found in those pesticides and plastics, in cosmetics, as well as in water. They act as endocrine disruptors, so they can bind to the estrogen receptor, impact hormone balance, and then can affect essentially the rest of the oat axis. So when we talk about estrogen and how to deal with estrogen dominance, we want to talk about detoxification, because as I mentioned, estrogen is a very important hormone for us, female or male, but it's the type of estrogen that we have in our system and the breakdown product of that estrogen that's really the important point. So in this picture, if you can kind of follow, you see estradiol on sort of the top left there, and it can be converted into all of these different things. So essentially can be converted to the 2-OH estradiol, it's called 2-hydroxyestradiol, the 2-hydroxyestrone, a 16-hydroxyestrone, and a 4-hydroxyestrone. So there's 2s and there's 16s and there's 4s. And these can then be converted or then are metabolized into different products. And we see the top one, the 2 is anti-proliferative, so meaning it doesn't proliferate so much, and then and is more protective, whereas the 16 and the 4s convert to active estrogens as well as themselves being carcinogenic and can impact symptoms of estrogen dominance. So the best way to make sure your estrogen or estradiol is being converted into the 2s versus the 4 or the 16 is to encourage healthy liver detoxification, because all of this occurs in your liver, and this is basically your phase 1 and phase 2 detoxification. So the liver is what we really talk about with estrogen dominance, because we want it to detoxify, inactivate, and excrete toxic chemicals, drugs, and hormones. And more than 50% of the metabolism of your estrogens take place in the liver. The liver breaks down hormones into the good as well as the bad estrogens. So we want to encourage healthy detoxification, more into the good, so that can be recirculated, and then the bad estrogens can be excreted out of your system, whether that's through bowel movements or through your urine. Another interesting point to make is that xenoestrogens can also act as obesogens. So obesogens are things that disrupt normal development and balance of fat metabolism and actually lead to obesity. So ironically, because estrogens and other xenoestrogens can be stored in fat, as you start to, if you are active or if you lose some of your fat mass, you can actually release more of those xenoestrogens, and they can act as obesogens, essentially creating a bit of a plateau. So if there's anyone out there who's trying to lose a little bit of weight or a lot of weight, but you are plateauing, a lot of the time that is because you're releasing a lot of hormones in the form of xenoestrogens, and your body is trying to actually protect you from that. So working with the liver is a key part to helping with weight management as well. All right, so what is estrogen dominance all about? How do you know if you have it? Well, there's lots of different signs and symptoms over there on the right side in that purple box. So lots of cycle disruptions, so heavy or painful periods. We see hormonal acne, PMS, we see hair loss, breast tenderness, especially sort of just before the period, a slower metabolism, brain fog, poor libido. We get the Oat Axis impact, right? So we also get thyroid dysfunction, migraines, endometriosis, uterine fibroids, and infertility. And in men, which can also suffer from estrogen dominance, we see sort of the male feminization, prostate problems, impotency, and male pattern baldness. We also see infertility and weight gain, and we see sort of what we call as man boobs. All right, I'll go back to that in one sec. All right, so exposure to both natural form of estrogen created by the body as well as xenoestrogens can lead to estrogen dominance. And we want to look at detoxification, but another key point of estrogen dominance is that not only do you have elevated amounts of estrogen, but you could also have lowered amounts of progesterone. And progesterone is that other important female hormone that is in balance with estrogen. It helps to create a healthy ratio Progesterone, if we want to be very simple, is sort of that calming. It's more the yin of the yin and the yang, and it's sort of the calming. It's really important for anxiety and really important for sleep, and it helps to sort of balance estrogen. So if you also have estrogen dominance, you may have low progesterone. We don't have time to kind of discuss this. That's where I generally recommend, bioidentical replacement of progesterone into the system, or working with different herbs that can actually increase progesterone. What we are going to talk about is really how to support liver, to support phase 1 or hydroxylation, and phase 2 methylation and glucuronidation pathways. There is also a third phase of detoxification, which occurs in the gut. So we will also discuss how to support that. The first is a few different behavioral things that you can do to support that toxin elimination. One way that I like to suggest is to start your day with a cup of warm water with a little bit of lemon. And yes, doing this too much or too often can affect tooth enamel. So I generally say, just get it down, don't swish it around in your mouth. If there are any dentists on the call, I know they all hate hearing this. You could use a metal straw or something as well if you prefer, to kind of prevent that from sitting on your enamel, or just rinse your mouth out with some plain water afterwards. But the warm water is very good. It helps to stimulate the body and the digestion. And the lemon actually contains more bitter components. So it's actually the sort of the rind, the pith, and the skin or the peel that helps support the stimulation of both the gallbladder and the liver. Kind of wakes everything up. And that's sort of how it works to help, again, support detox. Moving your body is really important, right? Circulation, getting the lymphatics going, which is, everywhere around the body, but also is what carries toxins out of the system. Avoid all of those harmful chemicals and plastics. Choose organic foods, follow that clean 15 and dirty dozen list. Detox with superfoods. So things that support phase 1 and phase 2 detox in the liver include the cruciferous vegetables like kale, cabbage, broccoli, Brussels sprouts. Turmeric is great because it contains curcumin. Apples and beets, as well as artichoke for their fiber and support of the gallbladder. And seaweed and garlic, which also support things like your thyroid and liver detox. Everyone likes to hear this, but dark chocolate, another thing that helps, it helps reduce damage to the blood vessels in the liver and contains high levels of antioxidants that help mop up those damaging particles from the body. And then finally, if we're talking about supplements, getting something that is a combination of herbs to help support that phase 1 and phase 2 detoxification, such as Estrosense. So Estrosense is from the Women's Sense line, and this is a complete natural formula, and it contains different components to help support phase 1 and phase 2 detox, including calcium D-glucarate and indole-3 carbinol, as well as green tea extract, turmeric extract, rosemary extract, lycopene, sulforaphane, and milk thistle seed extract. So this helps support that healthy estrogen metabolism and maintain hormone balance. It does reduce the symptoms of estrogen dominance. Typically, I see this within the first 2 to 3 cycles, where if it's hormonal acne, that typically starts to resolve. Mood swings, a big one that changes quite early on. The breast tenderness as well. So if you're getting that cyclical breast tenderness, those are some of the main ones that I see improving quite quickly. It also helps with heavy and irregular periods. I've seen even some women that maybe take a little bit more than the recommended dosage of things like this, but they can actually help shed uterine fibroids. So again, with endometriosis or fibroids, this helps to actually eliminate that, which helps reduce pain and heavy bleeding. It's going to help support liver detoxification, again, the reduction of PMS and hormonal acne, as well as promote a healthy breast tissue. So the recommended dosage for this one is 3 capsules with food once a day. I've actually involved in a clinical trial using this product with my patients quite a few years ago before COVID. And it is actually being published, I think, in the next month or 2. And basically what it showed was at this dosage, those estrogen dominant symptoms were clearing up, but also that was backed by clinical results showing that the Estrosense was supporting that proper metabolism of estrogen into the 2 estrogens rather than the 16 and the 4. All right, and then to support that phase 3 detox, which I mentioned very briefly, to support the digestive tract, there is something called the Astroblum. So the Stroboulome, maybe or maybe not, you haven't heard of this, but it is the collection of bacteria and other microbes, as well as their DNA, that's capable of metabolizing and excreting estrogen metabolites. So when the estrogen metabolites go from the liver, your body wants to detoxify and excrete them. If the bacteria living in your gut are not supportive of this Estroblum and supportive of excreting estrogen, you can actually reabsorb those estrogen metabolites. And actually you can deconjugate or reconjugate that estrogen, making it even more toxic, which then you can absorb into your bloodstream, creating even more havoc. So that unhealthy Estroblum can lead to higher levels of beta-glucuronidase, which is the enzyme that normally would deconjugate estrogen to its active form. And so in this way, you are getting higher levels that can recirculate and just aggravate your estrogen dominant symptoms. So a few ways to support the Estroblum. You guessed it, probiotics, right? As well as good fiber that will help feed good bacteria, but not necessarily feed the bad bacteria. So dysbiosis by definition is when you have an improper ratio of good to bad. And one way to actually reset that would be with a broad spectrum probiotic. One I've mentioned here is the fermented whole food probiotic, because it also has pre and postbiotics. So it helps support the growth of the probiotics once they get into your system. And they also help with the production of the byproducts of probiotics, including things like short chain fatty acids, which ultimately help us with gut health and help us feel well. Another thing, of course, is with fiber. So I just have this one here because it's a low FODMAP fiber. We won't get into SIBO today, but if you have SIBO or heard of SIBO, and you have, like, say you have quite a bit of bloating or either frequent stools or constipation, if you have SIBO, taking a regular type of fiber can actually make that a lot worse. So things like psyllium and bran can really aggravate SIBO. So if you don't know if you have it or not, I'd say just go for a low FODMAP fiber. It's not fancy in any other way except for that it's coming from something that's not going to feed bad bacteria. And of course, I would recommend an organic one. So this is one that's, again, from Women's Sense, and it is called Fibersense. So just to recap, the fermented whole food probiotic has 10 billion active cells, and it's 10 different strains of beneficial bacteria. So it's going to help you with your GI tract, with your digestion, with, if you have gas or bloating or constipation or irregularity. As I mentioned, it helps to create those beneficial postbiotics and includes prebiotics. And it's fairly simple to take. It's one a day. You don't have to take it with food, but you can, and it's also shelf and refrigerator stable, so you don't have to rely on keeping it in the fridge. I find that most of my patients, if something's in the fridge, they're going to forget to take it. So this way you can keep it on your counter with everything else, so you can maintain a healthy gut to help keep your estrogen healthy. All right, so that was estrogen and our ovaries. So now we'll get into the second part of the Oat Axis, which is our adrenal glands. And again, I think most of us, could use a little support, especially after the last few years of higher stress than we're used to. So the adrenal glands, with, hence the name, is they are sitting above the kidneys. There are two of them, one on the right, one on the left, and they are crucial for a healthy life. They are what respond to stress in your life, again, which we are all exposed to. And they are involved in stress adaptation so that they can keep you responding well to the different things that occur in your life. And if treated well and supported, they will be healthy and happy. But unfortunately, a lot of us are exposed to chronic levels of stress, and this can lead to exhaustion. So if this is a live audience and I could see all of you, I would ask, what is your stress? What stresses you out? Or is any of these something that, you deal with? Because I always like to kind of connect with my audience. But regardless, maybe one of these is something is higher on the list for you. But regardless of what is causing a stress for you or what your stressors are, medical research does suggest that up to 90% of all illnesses are stress related. So eliminating stress could eliminate 90% of your risk factors for pretty much any kind of illness. There is other components, of course, with every other illness, but it is a huge part of overall health. There's a list of many different health disorders that chronic stress will put you at risk. Because we're talking hormones and female health today, these are ones that I commonly see. So mood changes like depression and anxiety, as well as OCD. Insomnia is a big one, ADHD and ADD, memory problems as well, including dementias, heart disease, immune system rundown, weight gain, fertility concerns, and digestive disturbances. So how do we support stress in our body? We need stress, or we are always exposed to stress, and we have to adapt to it. And there are three main stages of this adaptation. Now, if we haven't really been exposed to stress all that much, then we're probably sitting in the alarm stage when we are under stress. So that means we go into that fight or flight when something comes up. Over time, if you've had a lot of exposure to stress, you will start to enter the resistance stage. And when that occurs, when you are exposed to stress, you'll have many other symptoms that are going to affect your quality of life. And if you've sat in that stage for quite some time, you will eventually enter the exhaustion stage. And that's where we see it much more difficult and tricky to get out of, and requires a lot more in terms of healing. So I'd say majority of my patients, and perhaps everyone a lot of you on the call today, are sitting in that resistance stage. So you've experienced stress in your life, but you no longer are just getting the fight or flight. You're not just getting high blood pressure and heart rate and sweaty and this and that. You're getting further systemic symptoms. So you might feel more inflamed, right? You might feel more sort of flabby or swollen, or retaining water. You could feel more anxious. You could have irritability or some mild depression. You could have issues with sleep. Maybe you don't fall asleep that well anymore, or you wake up in the middle of the night, or you don't feel rested when you wake up. Cold hands or feet can come along. We see back pain and arthritis. We see an increase in your allergy symptoms or asthma. You may start to crave things like salt, sugar, and coffee or other stimulants. You might feel overwhelmed and unable to cope when you have a stress in your life. You start to have that belly fat or spare tire around the midline, which is also can be very difficult to lose, because again, your body starts to hold on to weight in that location. You might feel dizzy, especially when you stand up suddenly from a seated or a lying position. You might get more chronic headaches, and of course, other hormonal imbalances, because this is part of the Oat Axis. So this adrenal imbalance will lead to imbalances in both the thyroid and the ovaries. Now, if you leave that untreated, you can enter the exhaustion stage. And as I mentioned, this is a much more difficult to kind of get back from. It takes a lot longer. We do say, naturopathic medical doctors do say, for every year of stress, you really do need 1 full month of very intensive adrenal protocol. So, if you've been under stress for, 25 years, that's 2 years of adrenal support that you're looking at. Now, at least it's not the same amount of time, but it does require, quite intensive support if you've had many years of stress. So I just included this as like a cortisol graph from a patient probably 10 years ago now, but she was one of the first that I really did see a flat line. So she's in the exhaustion stage because her adrenal function, starting in the morning all the way to bedtime, is below range. She's basically unable to produce the cortisol that she needs throughout the day, where it should be quite high in the morning so that you get up and go and you feel refreshed, and then become quite low at night so you can fall asleep well. So in this case, She is totally flatlined, and we actually have to increase her cortisol, increase her adrenal function. We also found, or not we, but the Whitehall study also found that people with a flat cortisol curve have a higher risk of cardiovascular disease. So even though you have lower levels of cortisol, we always assumed high stress and high cortisol equals higher risk of heart disease, which is true. Low cortisol is also a risk factor for cardiovascular disease. And we all know that that is a very common cause of mortality in Canada. So where do you sit on that spectrum? Do you have high cortisol? Do you have low cortisol? Which stage are you in? There's lots of ways to test yourself. I showed you that graph of a woman that did a saliva test. You can do urine testing, which is typically the one that I do now, mostly with my patients. But you can also do questionnaires to get a very good idea as to where you're sitting. So I will have this link up at the end as well, but you can go to womensense.com/stress-test, and you can do the adrenal stress test, which is a few questions, and you basically score your points at the end to determine where you are in sort of that spectrum of adrenal function. And that'll kind of help you determine how to help your adrenal glands. But if you don't know where you are, then these are some suggestions that will actually help you regardless if you're in fight or flight, resistance stage, or in exhaustion. So, I mean, again, we hear this all the time, but whole foods and wholesome nutrition are really important. You need to give your body the nutrients it needs to actually function. So eat a variety of whole foods, have regular meals, make sure you're getting lots of protein and lots of fiber, good fats, healthy carbohydrates, but not too high in the glycemic index. So avoid refined carbs, avoid alcohol and sugars. And if you do drink coffee or other caffeine beverages, it might be a good idea to cut that down. Physical movement is also important. I do stress not to do extremely strenuous physical activity, especially if your adrenals are suffering, because that is a stress on your body and can actually make things a lot worse. I've seen lots of patients trying to lose that midline weight, that belly fat spare tire. They're going to the gym every day, or they have a personal trainer and they are doing high level intensity things. They can't lose the weight because that increased stress increases cortisol, causes the weight gain to stay on, and you're really just, in this vicious cycle of maintaining that fat and burning your body out. So look more to some of those relaxation exercises as well. So more of the yin yogas or Pilates, breathing and meditation. Remember to slow down, active rest, have fun time, make sure you're getting a good night's sleep, or at least look into ways to support your sleep if you're having issues with it. Optimize your nutrient intake. Some of the vitamins and minerals or nutrients are there on the side. So your vitamin Bs, vitamin C, vitamin D3, omega-3 fats, and magnesium are really important. So whether that's from multivitamin or getting some of those individually, you want to make sure those are optimized. And then finally, adaptogenic herbal support. So this is one that's going to be more medicinal, and that's going to help you really get out of that rut of wherever stage you're in. So this product I'm recommending here is from Women's Sense. This is called Adrenasense, and it is an adaptogenic formula, meaning it contains herbs that help you to adapt and help you regardless of where you sit in that spectrum of adrenal function. So if you can't get access to those testing, the urine test or the saliva test I mentioned, some of them can be really expensive. So if you don't have the means to do that right now, you, instead of kind of guessing where you are and what to take, something that is adaptogenic will actually support you in either sort of phase, whether you're too high or too low. So it's safe to take this if you do not know where your adrenal glands are sitting. This will help with reducing stress and promote relaxation. So it also helps just mentally, emotionally. It also increases energy and well-being. It will help to combat fatigue, improve mental and physical performance, especially after periods of mental or physical exertion. It helps to relieve general debility, aids in convalescence, and supports healthy cortisol levels and adrenal function. So recommended dosage is 1 capsule twice per day. Now that 2 times per day is again to support your cortisol in the morning when it should be higher, and in the evening when it should be lower. So again, very safe to take any time in your stress journey. It does have a recommendation to discuss this with your healthcare practitioner for use beyond 1 month. And that's only because if it's not helping, then you have to look into what else might be going on. But it is absolutely safe to take this. And I've had patients take formulas like this for months and months, maybe taking a little bit of a break here and there, but continuing something like this for extended periods of time is absolutely safe. Another note on adrenal health and stress is perception. And I really think this is important because this was quite an interesting study. There was a study that tracked 30,000 adults over 8 years. And at the beginning of the study, these participants were asked 2 questions. The first was, are you under a lot of stress? And the second was, do you think stress is harmful? So basically asking levels of stress as well as how they perceived stress, if they perceived stress to be harmful or not. And the study used public records to see who had died after those 8 years. And the people who experienced a lot of stress and believed that it was harmful had a 43% increased risk of dying. And this was corrected for a lot of other variables. So it's really interesting that perception played a very dramatic role. So people that did not view stress as harmful had the lowest risk of dying, regardless of how stressed they actually were. So if you have high stress levels, working with perceiving that and being more positive can actually help prevent that stress from impacting your body. And I like this little meme here, this picture, that being negative only makes a difficult journey more difficult. You may be given a cactus, but you don't have to sit on it. Okay, so let's go into the third component of the Oat Axis, and that is our thyroid. We'll start with some thyroid statistics. Again, I think this is quite important to understand. Well, first, recent studies indicate that 1 in 10 Canadians do suffer from a thyroid condition, and as many as 50% of this is undiagnosed. So 10% of us have an issue with our thyroid, and a large majority or a large part of us don't actually know that this is existing. And that partly is because of our poor testing in Canada, or basically our inability to access tests that give us a full picture of the thyroid. So the thyroid, with the top image there, I just want to go through this because if you've ever had a thyroid panel done or say TSH done, you want to make sure you're seeing the whole picture. So TSH is basically the hormone that every blood panel will look at. TSH stands for a thyroid stimulating hormone, and TSH actually is a brain hormone. It comes from the brain, comes from the pituitary, and it stimulates our thyroid, hence thyroid stimulating hormone. So it will stimulate your thyroid to make T4, mostly T4, a little bit of T3. So T4 is a hormone, a thyroid hormone, but it doesn't have a ton of activity in the system. T4 has to be converted to T3 to have activity in the body. T3 is what is responsible for all the things we know thyroid is responsible for, right? So metabolism, for energy, for skin health, etc. So T4 requires conversion from T3. Now, the limitation with testing only TSH is that you will not know, first of all, how much T4 your thyroid can actually make, right? So it could be stimulated a certain amount, but still not be making enough, or it could be making too much. And we also don't understand, we don't see how the conversion is going in our tissues and the rest of the body if we don't also look at T3 testing. So testing for all three, TSH, T3, and T4 is a much better way to assess your thyroid. There's also a little on the image below that, which indicates what an optimal TSH level is. And again, I'm not sure which province you are in, but in BC, through LifeLab specifically, the normal range is between 0.5 and 5.5. This image actually shows a bit of a different range than what we have in BC. But the optimal range is actually right around 1 to 1.5. So if you're looking at, if you're at a level of 2 or 3 or even 3.5, you are getting into a level which would indicate hypothyroidism. If you weren't aware of this, a higher TSH level indicates a lower functioning thyroid, right? So as TSH increases, your brain is trying to stimulate your thyroid more because it's not responding. So a higher TSH means your thyroid is more sluggish, means you have a lower functioning thyroid. So that's why we want a level around 1 to about 1.5 or 2, again, depending on what your normal range is in the province that you live in. So in addition to testing for your T3 and your T4, making sure you are getting the right or looking at the correct optimal level of TSH is important. So just to recap, your thyroid secretes 2 hormones, T4 and T3. The body converts your T4 into T3 at the level of your tissues, so in your heart cells and your liver and your brain, etc. And of course, T3 is 4 times more active. Now, if you're on any medications, Synthroid is a very common one, and we know that that is only T4. So if you're on Synthroid, you may not actually benefit from the medication if you're not converting that to T3. And so if you're on medication, you can take other things, supplements, minerals, things like that, to help with the conversion so that that medication is much more effective for you. Some people opt to take something called desiccated thyroid, which I will prescribe to patients, generally more so because it contains T4 and T3. Now, we also know that 80% of women also who suffer from adrenal exhaustion also have low thyroid. So if you have low thyroid, or if you've got symptoms of low thyroid, you probably have some adrenal fatigue, and vice versa. And we also know that higher stress and cortisol can actually inactivate our T3. So supporting the adrenals is key to supporting your thyroid. Now, we often see low thyroids as much more common than hyperthyroidism, so I'm not really going to get into hyperthyroidism today. Low thyroid presents as low energy. We see weight gain generally all over the body, cold intolerance, cold hands and feet, hair loss, receding hairline, dry skin, constipation, depression, infertility. You can also have anxiety. You can also have sleep issues. There's lots of different sort of caveats to this, but these are the main symptoms that we see with low thyroid. So how do we support thyroid? Well, food and lifestyle is key, as well as it was with our adrenals and our ovaries. So whole food diet. Include foods that are rich in iodine, so kelp, nori, and seaweeds. Now, there's a little bit of an asterisk there. If you are diagnosed with Hashimoto's, you may not want to increase your levels of iodine, at least don't take excessive amounts. But if you're, subclinical or sluggish thyroid, then you do want to support that iodine. Avoid GMO soy. So choose fermented or non-GMO soy and have that in moderation. That seems to really affect the thyroid. The thyroid imbalance is very often related to an autoimmune condition. And so GMOs, as well as gluten and dairy, can actually increase that autoimmune process, making your thyroid even more sluggish. Now, eat raw goitrogens in moderation or cut them out completely. And that means that you want to avoid things like broccoli, kale, cabbage, cauliflower, and turnips if they are raw. So these are really, really good for the ovaries and for estrogen dominance. So if you've got that as well, make sure you cook them because that will basically disable the goitrogens, which can, again, impact thyroid health. So you mentioned reducing levels of dairy and gluten because that can aggravate the autoimmune condition. Manage stress to support those adrenal glands. Engage in regular physical movement and avoid toxins like fluoride and bromine. I used to see a lot in Kelowna when I practiced there that, everybody has hot tubs, especially in the winter, they're in their hot tub. And a lot of people use bromine instead of chlorine for multiple reasons. However, bromine is quite toxic for your thyroid. So either avoid that or, rinse off or utilize other ways to support bromine excretion. And another way to support your thyroid, and this would be safe if you are on medication as well for your thyroid, for hypothyroidism, and that's called Thyrosense. This is, and again, it's proven, so we've seen clinical research for this formula. And it's a combination of nutrients, so L-tyrosine, which helps make your thyroid hormones, ashwagandha, which supports the conversion as well as supports that management of cortisol, which can impact conversion of T4 to T3. Google, which also supports thyroid health. And then we've got pantothenic acid, which is B5, copper, manganese, and iodine, all again to support thyroid health and enhance thyroid function. So this again is for low thyroid. You're not going to want to take this if you have hyperthyroidism, but you can take this with your synthroid or your desiccated. It is, however, best just to double check with your healthcare provider, determine the right dosage for you if you are on medication. So this is going to support that conversion of T4 to the active T3. It helps to enhance weight loss, improve your energy, support proper hormone balance, improve your sensitivity to temperature, and also help metabolize your food. The recommendation is 2 to 4 per day. So 2 in the morning, 2 in the evening or lunchtime, maybe not too close to bedtime, as it can help stimulate that thyroid and energy. And if you've got, really, really low levels of thyroid, you will want to take higher amounts. So 4 capsules a day. If you are on a medication, I generally recommend starting with 1 or 2 and then going up as needed. All right, so let's get through the final thing, which was the summary of how to support your Oat Axis and overall healthy hormones. And that is to keep on the exercise, keep on that sleep train, healthy eating, nutritious food, omegas, fiber, and whole food, lots of fiber. Reduce your stress and your perception of stress, and choose clinically effective supplements to support the different components of that axis. Last little sort of infographic there, just a reminder that these 3 parts really need to be in a state of optimum balance. As Dr. Michael Lamb put it, it is like a 3-legged stool. All of these 3 legs must be in perfect balance for that stool to be safe to sit on. Imbalance of that Oat axis leads to a myriad of conditions that can be annoying in their mildest form and incapacitating when hormonal imbalance symptoms are severe. Before we finish, I just want to mention a couple things. First of all, just about the Women's Sense line. I talked a lot about these products as well as whole earth and seed products here and there. But this line is a Canadian line, and it is also involved in the Women's Foundation in Canada. It does help women reach their full health potential, and it is free of common allergens. It's non-GMO, and they are all Assura certified. Assura is really important, especially when we're talking about detoxification and estrogen dominance. But Assura is something you'll see on different brands of products at your local health food store at Netters. And this is basically that seal of assurance that you're consuming something that is safe for you. They test for over 800 different contaminants. So all of those endocrine disruptors that I mentioned, things like glyphosate, heavy metals. It's also testing for GMOs. So when you see this, you can be, trust that the product is going to be non-GMO, contaminant free, and also what you see on the label is actually in the product. All right, and just to finish off, there are bonus bottles of each of these products that I mentioned today. There's others that are, there's Menosense. We didn't get into Menosense, but that's a really great product for menopausal symptoms. And $5 from the sale of all of those do go to the Canadian Women's Foundation, which is the foundation that's a leader in the movement for gender equality in Canada, supports women, girls, and gender diverse people to move out of violence, out of poverty, and into confidence and leadership. I'll take the time now to thank you all for listening, spending your time with me tonight. I have there's some social tags there if you are into all that. I just included mine as well. I'm more than happy to connect with any of you who might have more questions. And there is the link as well to the Women's Sense stress test, so you can see where you are in that adrenal balance.
Awesome. Thank you so much, Dr. Jen. We do have some questions. The first one is, how do I get rid of the muffin top? This is a great question. How do I get rid of the muffin top belly since menopause?
Awesome question. So I would say that's your spare tire I mentioned. So when you go through menopause, right, ironically our estrogens actually go down and progesterone goes down. However, estrogen dominance can still occur. And cortisol, over the many years, I'm sure, like many of us, there's high cortisol from stress. And as we get older, we can start to go into that resistance stage where the cortisol can kind of become wonky. And what happens is that cortisol starts to store fat, and it stores it in the midline. So that muffin top is from that high history of high cortisol, and it's exacerbated in menopause because once your hormones start to drop, your adrenals are even more stressed because they have to pick up the slack that the ovaries were doing. They basically have to start producing your ovarian hormones for you in much smaller amounts, but they become more and more taxed. So adrenal function support is the most important thing for that. So adaptogens, again, are going to be really important. So something like Adrenasense. If you want to know exactly where your cortisol is sitting and how it's impacting that weight gain and how stuck it's going to be, you can do, salivary testing or urine testing, but you have to do that, through private testing. So through a functional medical doctor, naturopath, et cetera, depending again on the province that you live in. So close note there is, or take home message would be, just adrenal support is going to make the most dramatic effect. It does take some time. I mentioned for every year of stress, you need about a month of adrenal support. So doing that adrenal support with all of the other things that we know, so exercise, but not too strenuous, whole foods, getting good sleep, staying hydrated, and having a good perception on life. Those are the things that I would say for that muffin top.
Next question. For the Women's Sense line, can it be taken with any medications?
Depends on the product. So I suppose, if there was a follow-up question to that, if you know which one you were curious about.
Yeah, if the person who asked the question wants to just follow up with which product, that would be awesome, and we'll come back to that one. Next question, for the Thyrosense, if you don't know if you're hyper or hypo, is this something you can take anyway?
I would suggest you get tested. So I think testing for thyroid is something we should be doing on a yearly basis anyway. And if it's been a long time, absolutely get tested. If you can only get TSH, at least you'll have something. But see if you can, through your healthcare provider, do T3 and T4, or if not, go to a private, clinic and just spend the money for a full panel. It's about $100. So it's not, ludicrous in terms of the amount, and you'll get the full picture of what's going on with your thyroid. If you were hyperthyroid and you took Thyrosense, you might get worsening symptoms. You might see things like more anxiety or palpitations or symptoms of hyperthyroid. If you took the recommended dosage, it's not going to send you into a thyroid storm. But if you do know that you could be one or the other, I would test to make sure you are confident in that before sort of, sampling it.
So the follow-up was for the Adrenasense on the medication. Okay. Yeah.
Yep. So I would say the only things you might want to avoid would be if you're on some sort of steroid, so something that might impact the adrenal glands. That's something that may impact, like prednisone or something like that. I would caution that there will be there will be on the label all the other conditions that you should ask your healthcare provider about. But it's usually the typical blood pressure medications, steroids. If you're hyperthyroid, you might want to, again, discuss this with your healthcare provider. If you have an allergy to any of the ingredients, of course, that would be something. But generally, it's quite safe for most people. If you're in doubt, then reach out to your medical doctor or a naturopath.
Perfect. Next question is, if your basic thyroid blood test comes back as normal, but you believe you have a low thyroid, is there a different test a doctor can run to check levels further?
Yes, so that would be T3, free T3 and free T4. The limit in the healthcare system pretty much across Canada is that MDs cannot requisition T3 and T4 without you paying out of pocket unless you have a diagnosis or previous diagnosis of thyroid imbalance. So in some provinces, you may just be able to pay the lab instead of going out and finding a naturopath. Otherwise, you may have to, look at starting a relationship with a healthcare provider that can do all of that type of private testing. It's really too bad, but it is just the way that medical services is trying to, keep their spending low. And so medical doctors will be flagged and they cannot do those types of test requisitions in most cases. So, the extra $100 or whatever it might be, it's maybe really very worthwhile to get or to spend to get those.
Does Estrosense help after menopause?
It can absolutely help after menopause. So like what it's meant to do is to support estrogen breakdown and metabolism. So even though our estrogen levels are lower in menopause or after menopause, if you still have an imbalance or if you're metabolizing into the bad estrogens or, family history of estrogen related cancers, right? It is something that is absolutely safe. It's not going to lower your estrogen levels and, give someone hot flashes and night sweats. That's not what Estrosense does. It supports the healthy breakdown of estrogen into the proper metabolites.
Perfect. And our last question is it safe to take all three of these supplements at the same time? Yeah, so I think the three that you spoke about.
The three main ones, yeah, Adrenasense, Estrosense, Thyrosense, yes, it's absolutely safe. I often recommend the Adrenasense with Estrosense and the Adrenasense with Thyrosense because the adrenals are almost always involved, right? We all have had stress in our lives, so our adrenals are generally the weakest link in the Oat Axis. So, but if you have all three, absolutely, it's completely safe, even at the upper recommended dosage.
Wonderful. That's it for us tonight. Thank you so much, Dr. Jen, for taking the time. And thank you to everyone who joined us on the call tonight. Some really great information. And again, if you do have questions about the products that were talked about, feel free to talk to your Nutter's associate or the Nutter's vitamin manager at your local store, and they'd be happy to help. Thanks so much, everybody.
Thank you. Good night.